We all know that care homes play a massive part in caring for some of our society's most vulnerable older people. Meet Fred. Like the thousands of older people that live in our care homes, Fred has complex conditions and multiple healthcare needs. Yet, there is a national and local concern regarding the basics. Yes, the basics. The most essential element for life and health. Water, fluid, hydration. Are the residents in our care homes getting enough to drink? It's true, unfortunately, dehydration remains a major problem with care home settings. Yes, older people, like Fred, are at greater risk of dehydration due to changes in the ageing process. And yes, this can be complicated further by underlying medical conditions, but dehydration can be easily prevented. The potential consequences of dehydration are many. Some will spring into mind straight away, but others you may not think about straight away. These include constipation, dizziness, confusion, falls, medication toxicity, urinary infection, respiratory infections, delirium, renal failure, seizures, poor oral health, pressure damage. And often, all too often, older people from care homes are admitted to the hospital setting for a management of dehydration. But dehydration can be easily prevented. Did you know that over recent years there has been a deluge of guidance documents to improve care in relation to malnutrition and dehydration? If you did know, or if you do now have a look for the guidance, then you might be disappointed, as you will see there is only a little reference to hydration within these documents, and there seems to be a focus on the hospital setting. So, what can we do? Well, the Hydration Toolkit for care homes has been developed. This is just for you. Just for care homes and care home staff, it is based on the best bits from any relevant guidance and from working with real care staff in real care homes. Those care home staff, like you, were busy, but found time to work to develop the toolkit to make sure that the residents in their homes got the basics. Yes, we're back to basics again. Let's make sure that Fred and all of the older people in our care homes get enough to drink every day. The toolkit contains a self-assessment quiz regarding the signs and symptoms of dehydration, an adapted version of the Gulp assessment tool, a series of innovative fluid monitoring charts, care planning guidance, and strategies and resources to increase knowledge about the importance of adequate hydration and ways to increase fluid intake for those older people in your care home. Some of the strategies include hydration checklists, hydration booster leaflets, resident and family information leaflets, ideas RE happy hours, preferred drinks choices, red jugs, posters, urine chart, pocket cards. Research has found that residents in care homes often fall into the following categories within our care homes. Those that can drink, can't drink, and won't drink. Let's think about this for a few minutes. Meet Bill. He's a fairly independent chap. He can ask for a drink and drink it with no problem at all. But does he know how much he should be drinking? Mary also can drink on her own if given a drink, but Mary doesn't ask for a drink and sometimes forgets to drink it as she likes to walk about the home. So, both Bill and Mary show characteristics of those that can drink, but different strategies may be useful in ensuring they both have enough to drink. Let's move on to Fred and Edith. Fred has had a stroke a few years back, which affected his swallowing, while Edith has become immobile and increasingly frail. Fred and Edith may fall into the can't drink category. They are physically incapable of accessing or safely having a drink independently. The toolkit considers strategies for those residents in your care that may be like Fred and Edith. Finally, there's George and Iris. George, well, he admits he's never been a big drinker, always on the go at work and then in retirement. No time to stop for a brew, too much to do, places to go. And Iris, well, she's just too worried that she might be a burden, that she might not make it to the toilet on time, that she might need to go in the night. Again, the toolkit identifies some strategies to consider for the likes of George and Iris. This isn't about labelling residents, but it is about stopping and thinking each day to really think, how much have the residents had to drink today? So, have a look. Pick and choose what you think might be useful for you and your care home. Think about the older people that you care for. Think about your staff. Do they all know about the importance of making sure everyone has enough to drink? Think about those visiting relatives and friends. Can they help your older people too? Each element of the toolkit is downloadable. Just remember not to photocopy the urine charts in black and white, as they will be meaningless. If you require any more information regarding the toolkit, then please drop us an email at hydration@lancashirecare.nhs.uk.